Hey, good afternoon to everyone who's here, anyone who may be listening. Comments did not meet at our regular date and time last week because we would not have had a quorum and not conduct business without a quorum. So this was the date set for this meeting in order to have a quorum. And so, having said that, anyone here or watching can't see, health department is now requiring masks for anyone entering our building. That's due to higher rates of transmission in these cases of COVID, higher hospitalization rates, and I'm sure we'll talk more about that during the meeting. So, having said all that, I'll call this meeting to order. It is just after 3 o'clock on Thursday, August 4th. So this is the regular scheduled meeting of the Jefferson County Health Department Board of Trustees. So can we have a roll call, please?
Mr. Deal,
Here.
Dr. Henry,
Here.
Mr. Prater,
Here.
Mr. Pig, Ms. Davis.
Here.
Okay, so we have 4 or 5 members here, so we do have a quorum. And normally we read the Health Department mission and vision. Can you do that for us, please, Dr. Henry?
JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. Vision is advancing the health and safety of Jefferson County.
Thank you. Next, I need a motion and second to approve the proposed agenda.
Motion to approve.
Second.
A motion and a second, so any discussion on that? Okay, hearing none, the agenda as written is approved. We have another set of approvals here. First
You're gonna take a
is,
vote, Mr. Point of order.
I'm sorry. So we had no discussion. All in favor of approving the agenda as written, please say aye.
Aye.
Aye. Pardon?
I voted no.
You voted yes. Approved, 3-1. Sorry, I jumped the gun without that vote. So next is approval of the May 26, 2022 meeting minutes. All board members were present for that meeting. We all received copies of that in the packet, as well as all the other things we'll talk about today. So we have a motion second to approve those meeting minutes.
Motion to approve.
Second.
Okay, any discussion on that?
Mr. Yep.
Yes, ma'am.
I see a lot of problem with the way that members are speaking to other members during our meetings. And just for example, all over this paragraph, Mr. Pig was referring to me, calling me names and different things like that, not using big words like nefarious and labeling me, and bullying me, literally. And I just want to make it aware that I'm not going to stand for that. This type of behavior needs to stop. We're here as a board to conduct business and not to yell and scream at other people and call them names.
I totally agree with that, Ms. Davis. and
So it's in the
that-
minutes, so I'd like for all that to be stricken out.
We cannot change the minutes.
Okay, good. Well, just shows how he behaves. It's
And
uncalled for, and
it's
as a chairman, I hope that you'll handle it.
two-way street, Ms. Davis. You've been very often out of order. So I hope that does not continue. And so again, we have a vote on approving those meeting minutes, please. All in favor, please say aye.
Aye.
Opposed? Three voting, Davis.
I'm gonna vote no that I don't approve of the minutes.
So we're approved 3-1. Approval of the June 2022 expenditures. Amount I have is $238,155.97.
So moved.
Second.
Okay, discussion on that.
Mr. Chairman, is, if within that figure are the legal fees included?
Yes.
Okay, then I'd like to address the continued, I believe these overpriced legal fees. There's,
Ms. Davis, you've been given the opportunity.
I'm sorry, sir, but I have the floor.
I'm chairperson.
I'm
You've been
just-
given the opportunity to look at those whenever you want to. Never taken advantage of that.
Excuse
We
me?
can look at those in closed session if you like, then everyone can have their own say.
Well,
So,
right now, while we're on public record, people are watching.
yeah,
They need to know that we've spent another $4,500 in legal fees that last year, this time, year before that, it's costing us $5,000. I believe it's absorbing. I believe that there's too much time being spent on sunshine requests. It doesn't need to go to an attorney. We just need to produce the paperwork before.
that's your opinion, man. This has been,
You know, we're wasting our taxpayers' dollars.
I think you're totally correct, man. This has been a very unusual year. Lots of things that are requiring legal help. You have no perspective on what is appropriate and what is not. And so.
I beg
all
your
can
pardon,
say
sir,
is
you're gonna be telling me what I have perspective on when I'm a board member elected by the people
You've
to
been
bring
here,
things to their attention that I see as off.
you've been here 1 year, ma'am. I'm not gonna argue. with
So
you.
you don't need to argue with
That's
me.
your opinion.
That's my opinion.
Thank you.
That is correct.
All right, so let's vote on approval of those expenditures. All in favor, please say aye.
Aye.
Opposed?
I vote no.
Thank you. That's 3-1. Approval of the June 2022 electronic payments. Actual amount for those is $495,362.88.
Motion to approve.
Wait a minute, I don't, what did you say, $495?
Yeah.
Okay, yes, I'll second.
Discussion on those. Hearing none, all in favor of approving those electronic payments, those are the actual payments. Please say aye.
Aye.
Good, thank you. Those pass 4-0. Pre-approval of the estimated amount for the August 2022 electronic payments. The estimated amount is $606,562.25.
Motion to approve.
I'll second.
Okay, motion and second to approve. Do you have any discussion? Hearing none, all in favor of approving those, please say aye.
Aye.
Anyone opposed?
Myself. I vote no.
Yes. Okay, moving on. Next is our director's report.
Okay, the first up will be a health update on congenital syphilis in Missouri. Our clinical services manager, Melissa Parmalee, and Sarah Warnicki, our nursing supervisor, will be providing a report.
Here. Here. Yep, you moved it on me. I didn't. Believe me, I need to shine my spotlight with it. Here it is. Over.
So I'd like to introduce Sarah. She's our nursing supervisor. She's going to be helping go through the syphilis report. Before we start in with that, I just wanted to remind you that you do have the clinical services summary for June in your packet. The only thing I'd like to highlight is our new EHR implementation. We did that this week, so you'll have a full report of that on next.
Explain what EHR is, please.
Electronic health record.
Thank you.
I will just have to say the team has put an enormous amount of time into building a system and doing training, and they have done a fantastic job. I really appreciate it.
Okay, so let's talk about syphilis, huh? So you may be asking yourself, why are we talking about syphilis at this point? So in June, the Missouri Department of Health and Senior Services issued 2 different reports. They issued a health update due to a sustained increase in syphilis cases in Missouri. They also issued a health alert due to an increase of congenital syphilis in Missouri. So you do have a copy of both the alert and the update in your packet, so you can read through that.
I'm sorry, Melissa. Could you explain for everybody what congenital syphilis is?
Yeah, we will definitely get into that.
Okay.
So just looking at that background, right? Syphilis is an STD, and it is something that's treatable, but can have some severe outcomes if it's not treated. And congenital syphilis is when it's a pregnant mother passes that along to their baby, and it can have some bad outcomes for the child if left untreated. So when we first got the update from Missouri back in February saying, hey, we have some increased cases in Missouri. And by the way, this is not unique to Missouri. We are seeing some trends across nationwide. We started trying to figure out how do we get data just for Jefferson County. So we started working on what does our Jefferson County data look like. And the chart that you have in the background there shows that, yes, indeed, we have seen some increases in Jefferson County as well. The chart shows from 2015 to 2022 increases across the board from congenital to each stage of syphilis over the last 7 years. And then we started talking about, well, this is going to take a little bit different approach for us to tackle that from a public health perspective. So we put together an internal group, and Sarah's going to share some of our actions and where we're going from here.
So what do we do now? We are going to do what public health does. We're going to educate, we're going to collaborate, we're going to test, and we're going to treat when indicated using our state and our CDC guidances. So this internal work group is a great example of public health collaboration. So we have our guidance from the State Health Department, DHSS. We have our internal work group that works off of those guidances and data collected from our emergency response department. That data then will go to our nursing department so we can get a plan of action together. Where do we need to be focusing our testing services? Beefing up our clinic testing, getting out into the community in those hot spots for testing, identifying those folks who need treatment, and getting the appropriate treatment. Our marketing department has been very helpful in the education piece. We are going to provide more in-house education that folks who come here to utilize our services can then leave with to refer to. Brianne knows all of the things about social media and getting our message across on all of our platforms. So this is the beginning stage of our planning process. As far as expanding testing and education in-house, we will be utilizing more of an opt-out testing approach, changing our language to offer syphilis testing across the board and encouraging that. Expanding that conversation into more than just our STD clinics. Within our family planning clinics and wellness visits also.
Just as an awareness, we'll be continuing these conversations and plans and actions for a period of time to be able to affect these numbers. It's going to take time and continued effort and education.
May I ask, do the district personnel still get involved in system cases, or
They do.
they do?
And we work very closely with them. When they receive a positive syphilis report at the state level, that's when they identify, what region, what county that individual needs resources from, and will reach out accordingly. And we coordinate bringing those folks in for education, for treatment, and also partner with Eastern District on obtaining the medications.
Any other questions on the syphilis report or on the clinical services report? All right. Thank you, guys.
Thank you.
Thank you.
Thank you.
Okay, next up is Gina Vidic, and she is going to be giving us an update on monkeypox.
That's presentation to follow up. Syphilis and now monkeypox. So I put my full update in the packet that was sent out to you, and so I just want to kind of hit some of the highlights. Put this together on August 1st, and there at that point had been 5,189 cases of monkeypox in the U.S. When I looked at it this morning, as of yesterday, there was 6,617. So a pretty significant jump just in those 2 days. CDC is reporting that Missouri has 12 cases as of today, whenever I look at the website. Of those cases in the United States, we do have at least 2 children that have been identified and 1 pregnant woman. So those are starting to be our outliers, are starting to pop up outside of the traditional group that we were seeing with this outbreak. We are working closely with Mercy Jefferson and Comfrey to make sure that we understand the resources in the community and what roles each agency plays to make sure that we have a comprehensive plan for anybody in our county that would need help. And do testing at the health department. For the most part, everybody is recommending, if you have a primary care provider, you need to contact them. They have their full medical history. That's your place to go. If we are your provider or you don't have a provider, give us a call. Let us know what your concern is, and we can get you an appointment, and we can do testing here at the health department and at any of our locations.
Now, could you explain to us what monkeypox is and to people that are watching?
Yes, yeah, I'm sorry.
Some a condition of the skin? Or?
Yeah, so monkeypox is a virus, and it belongs to the orthopox virus, which typically we see is smallpox, cowpox, and monkeypox. None of those are typically that you see in the United States. They are endemic to African countries, but not here in the United States. We've not had a monkeypox outbreak since 2003 in the United States. Symptoms, everything kind of starts with those flu-like symptoms: fever, headache, muscle ache, backache, and then the rash is what sets monkeypox apart. It is spread person to person, so direct contact with those rashes, scabs, that the fluid. Sorry, I'm jumping around now. It can also come from animals. So our 2003 outbreak was from prairie dogs. So animals were brought into the United States. They were housed near prairie dogs. The monkeypox went to prairie dogs. Those prairie dogs were adopted, sold. They were pets. So as they came into homes, we saw monkeypox in family settings. So Missouri was one of the states that was associated with that outbreak in 2003.
So where are the cases at right now? Are they kind of distributed around the United States or kind of in one area, like out west or something?
So I think all but 2 states have cases. New York, Chicago, California were the big 3 states. They really are scattered. And I think you kind of follow the metro areas where we have international airports or big cities. That's where they're clustered at this point, but they are spread throughout.
And so the contact with the fluids and things is what makes it spread.
We are working with the St. Louis metro region for a vaccination strategy. So we do not currently have vaccine in-house, but at this point, we should have the availability to get it from the state or from our hub in the St. Louis metro region. And we're looking at whether or not we do have the ability to vaccinate at the health department. So we're looking at if we had to do a curbside drive-through type setting. We are also looking at a regional plan to have bigger types of clinics once we can get approved to do the post exposure. Gets very complicated. The PEP++. So looking at folks that have high risk exposures, but maybe can't identify or it's not a confirmed positive. There's some higher risk settings and some criteria that folks could get vaccinated for right now. In Missouri, we're looking at just exposures, high risk exposures to confirmed cases. So it's very limited. We have very limited stock in Missouri. The CDC has allocated it based on number of cases in your area and your demographics and population. So right now, Missouri is really low on that list. So we have very limited stock. But it is available. We can get that done.
And I think what maybe people might not understand about monkeypox is it something that comes and goes, or is it something that once you get it, you build your immunity to it, like we did the chickenpox and mumps and measles, or is it something that can kill you?
So at this point,
Is it killing anybody? Let's just say that.
so I haven't looked today, but at this point, I have not heard any deaths from monkeypox.
Okay.
They do say it's very painful, so it's not something that you're probably going to ignore. Not everyone has to be hospitalized. A lot of folks can stay in their house and go through that process. But they are saying that during this outbreak, they're seeing a lot more painful lesions, and folks having more issues with that.
And how long does that usually last? A day, 2 days, 5, 10 days?
So you're looking at 3 to 4 weeks. You're considered infectious, and you're considered infectious until your lesions have those scabs have fallen off and the skin is starting to heal back over.
So those lesions, they look like chickenpox kind of?
They look like a lot of things. I wish Sarah and Melissa were still here. Oh, yeah. I don't think we need pictures today. It definitely resembles herpes. It could look like a pimple. It could look like a bug bite. Past outbreaks, they normally start on the face and extremities. As this one is being transmitted through this specific outbreak, it's a lot more lesions on the genital area. So you wouldn't necessarily see somebody walking down the street and notice it like you would when you see the older pictures from past outbreaks. Sorry, I have a rigor on this. Way over there. Let's see. One of the biggest things that we are trying to work through is our education. Monkeypox is not an STD. So syphilis is an STD, monkeypox is not. It is following that trend right now during the current outbreak of close contact and sexual activity, but that is not the sole means of transmission. We're really looking at direct or indirect contact with those lesions. So we're seeing that it can go through. So your bed sheets, if you're doing laundry, you're caring for somebody, especially if you're a caretaker, having to help somebody get up and move them around. Anytime that you have that indirect contact with something that lesion has touched, it can transmit. The good thing is we're seeing that there has not been a single case of a healthcare worker acquiring monkeypox. So we know that our disinfection and our PPE are working. So we just want to make sure that we give this education. So if someone's needing to isolate because they have monkeypox, making sure they're disinfecting, they're isolating by themselves. If anybody's needing to help them, they're wearing gloves or wearing their mask and they're taking all those precautions. Questions? Anything else?
Thank you. Thank you. I had one more thing I wanted to mention underneath the director's report, and I'm going to pass around. We received in a 2022 Innovative Practices Award from the National Association of City and County Health Organizations. We received an honorable mention for the Aspen project. The Innovative Awards focus on practices that were developed in response to emerging and exacerbated health inequities due to COVID-19 and demonstrate effective community partnerships and collaboration, adaptability and quality improvement, and remarkable innovation. And so just wanted to give a shout out to our teams, especially Jacqueline Brown, who has been spearheading Aspen for us, and let you guys know that the team picked up the award at this year's NACCHO annual conference. So it was great to be recognized.
Congratulations.
Anything else, Kelly?
No, sir.
Okay, thank you. All right. Have no old business. New business. First item is to act on recommendation to adopt our revised operations manual.
It's not.
No.
Okay. Then we can strike that for, I apologize, I didn't realize it wasn't.
That'll be ready for review.
We'll table that.
Do you want to kind of just explain that
Sure.
it's a separate document that has been
The
created?
operations manual is predominantly a lot of what we took out of your employee handbook because a lot of what was in there didn't really pertain to the governance of your employees. It was more about day-to-day operations, like internal policies and administrative procedures. So we pulled that out and then we're going through and kind of reorganizing, updating it to make it a little more user friendly.
So next, we'd like to discuss 2022 employee salary.
Sure. The salary increases, so we are asking for the regularly budgeted salary increase for staff, which is scheduled each year starting July 16th. With that, this year, the total amount of the request is $76,669 for 6 months. The approved budget that we put into place at the beginning of the year was $79,135. So we're $2,466 under that budget. We would need to make 3 motions. The first motion is to increase the non-exempt hourly employee wages by up to $1 effective July 16th, 2020. The budget impact would be $47,714 if everybody received the $1 raise, which is what was budgeted. 2022, did I say? Sorry about that. The 2022 budget impact.
So moved.
One second.
We need to vote on it separately. Okay, so we've got a motion and second to increase hourly employees' wages by $1 an hour. And if everyone receives that, the total increase, or I'm sorry, the total amount would be $47,700. Yes.
Would that include yourself too as well, Kelly?
No.
As a contract employee?
No.
Yeah, yours is still the same. This is the rest of the employees?
This is the hourly non-exempt employees. There'll be
What
3
does
motions.
non-exempt mean?
That they're hourly. They don't make salary.
They don't make
The hours they work.
Gotcha.
Okay. No other discussion, all in favor of that increase, please say aye.
Aye.
Okay.
Okay. The next motion is to increase exempt salaried employee wages by up to 4%, effective July 16th, 2022. The budget impact would be $26,355 if they were given at the full amount of 4% for all employees.
Kelly, it's like review based.
Correct. So just, I thank you, just for your knowledge that all employees receive a performance appraisal and development throughout the year. So that this is based upon the recommendations of their appraisals.
So moved.
Second.
Okay, second, so I have one question too, or well, one
Sure.
comment. So these are effective for August and they'll only run till the end of the year, correct?
Correct.
Okay.
So this would be July 16th through December 31st. Is that correct, Kristen? Yes.
Any other questions or comments?
Mr. Chairman, this would be directed to Kelly. So the salaried employees, okay,
Yes,
that's
ma'am.
what we're referring to. What is the scale from what to what are they making per month? From the lowest point to the highest, what are our, you know, salaried employees making?
I don't have that information in front of me now.
Just a ballpark,
I can't give you a ballpark. That would have to come out of payroll.
okay.
I can follow up on that information. I'd be happy to get it
I'd like
for
to
you.
just see it. you know,
Sure.
See what we're doing. Okay.
Anything else? Okay, all in favor of that increase, 4% to exempt or salaried employees? Please say aye.
Aye.
Anyone opposed? You gonna vote, Ms. Davis?
I need more information to vote, so I'll withdraw my vote.
There's no withdrawing.
You didn't with, you
It's
didn't
abstain.
vote to withdraw, so either it's a yes or a no.
It has to be yes or no.
You can
You
abstain.
can abstain if you have a conflict.
I'll say yes.
And then the final motion was to move to increase the director's salary by up to 4% effective July 16th, 2022. Such increase as is allowed under the terms of our current contract and is commensurate with the increase paid to other exempt employees. Impact to the 2022 budget is $2,600 if funded in full for 40%.
Give a motion second for that.
So moved.
Second.
Okay, any discussion?
Mr. Chairman.
Yeah.
So what employees would that be? Would that include yourself?
Yes.
Just for the director.
So I would, if anybody else beside you?
No.
Just you.
It is a separate motion that is allowed under the terms of my contract and is commensurate with what we just approved for the other salary
And then your
employees.
current salary is right now what? Okay. It's public record and the people would like to know.
Do you have the salaries on all of the exempt employees that you also just?
No, I want Kelly Blumers.
Is there a reason you're singling me out
Oh,
among all of the
I just, you're the
employees?
director and you know, the people would like to know what the director makes in your contract that you have right now with us. Because you're asking for a raise possibly. So yeah, we'd like to know.
So Ms. Davis, as far as I know, I was gonna say I have to look.
I'm trying to find it here real quick.
All right.
If it hasn't gone up since we did it a year or so ago.
No.
It's been steady. Then it was a set at 125,000, I do believe.
125,000 for telecom. Okay. So I would
Let's call
recommend that
let's
it
call that a
stays the
process.
same. I believe that's a sufficient salary for a director here, and I don't believe that we need to raise that one.
We're talking about an increase up to 4%. So you're saying you want to keep the same salary.
I do.
I do want to keep it
Okay.
up. I think that we gave her a nice increase already, and I think that's good.
Any other recommendations? Discussion? Again, I think that we should take note that this is only to the end of the year. And we're talking about $2,600 total. So keeping that in mind, all in favor of increasing the director's salary by 4%, please say aye.
By up to 4%.
Up to,
I think the board
Well,
still
we-
has to review, right?
correct.
Yeah, the board still has to conduct a review to set that increase. We're just approving up to 4% depending on what our personnel review does.
As we did for the one before, it's just treating her the same.
It's just treating her like everybody else.
That's a good addition. I hadn't thought about that, so that's fine. Okay, having said that, all in favor, please say aye.
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 And I don't know, of course.
The next item on the agenda is to look at increasing the JCHC mileage reimbursement rate. Our current rate is 0.475 cents per mile. The IRS has recently increased their mileage reimbursement, and the state has acted in accordance. State did not increase theirs as high as IRS rate, but did raise theirs to 55 cents per mile. And we have traditionally followed the state rate in order to ensure that we are in line with our budget contracts and reimbursements for employees working with those. So the recommendation, sorry,
The IRS actually has announced that they're gonna increase the rate up to 62.5%.
correct. So the IRS is going up to 62.5%. The state did not increase all the way up to 62.5, which is the reason we looked at the increase of 55 cents so that we were in line with state. So actually, we're asking for less than what IRS has
So that the
allowed.
employees would be able to submit the balance of the IRS rate compared to the state rate or whatever the state guys approve under taxes for unreimbursed businesses.
That's what I was getting ready to ask. Yeah, I thought that when I was reading this yesterday, I thought the rates were silly, that the state should just match IRS and save some paperwork.
Right.
Sorry for being.
They never have.
Are we having a discussion? Is it okay to ask a question?
Yeah, but you guys have a question.
So
I make a motion that we increase the rate per mile to 55 cents.
second.
So this would be like people that are employees or whatever, and staff here that has to go somewhere and use their car, their gas, their mileage. And they're submitting a mileage record to us and we're paying them.
Yes, ma'am.
It will be, if we pass this, 55 cents a month, correct?
55 cents a mile, yes.
Okay. Here's something that I think that, the board should think about, I know we're volunteers here, but, we have, and I was reading in the bylaws, it says that, we should be able to submit bills for our expenses as well. I buy paper, I buy toner, I travel here from High Ridge, which is a 35-minute drive. Each time I come, you do as well. And if you're coming up for trustee work, you're here at the center, we do the same. I think that that should go for us as well. I think we should add an amendment to the thing that's here stating that this would also cover that the board members should be able to submit their expense for gas as well.
I think state statute says we can't.
Simple expenses, we're not gonna take advantage of it anyway.
That portion of the bylaws is for, let's say if you attend a conference in order to receive additional education, it's not for the performance of your duties as a trustee. Whenever you ran, you knew that you lived in High Ridge, you need to fill for that because we're here. So it's something that's in the normal course of your position as a trustee and would not be reimbursable under the state tax.
And if it wasn't for the trustees, there wouldn't be a department that could run because you guys, the health department has to have the trustees. So
But
as a respect, out of respect, I think that Especially with the price of gas now, $5 now.
This wasn't an agenda
It should be,
item. I think.
it can be added to.
is,
It would require an amendment to your bylaws, and by the way, it's not a legal amendment to your bylaws, so you can't trump state law by your bylaws.
You mentioned that those expenses like Jackson, but that's not reimbursed.
Yeah.
Charitable.
Or charitable donations, correct.
It's an agenda item for. next month.
I think it would be.
She just said we can't.
We can't, it's illegal.
Can't.
If it's in our bylaws, it says we can be
State law.
reimbursed for expenses.
State
when
law.
For
we're-
business, the expenses that are out of the ordinary course of business for your role as a trustee, and like you're provided electronic copies of court packets if you choose to run those off at home, that's the expense that you're incurring on your own.
Yeah, all the times we have video meetings, all that stuff that we
You
printed
have
out.
it right there in front of you as a PDF. If you choose to print it out, that's on you.
I just think it's disrespectful to not offer to pay the trustees for their gas coming and going. Especially when it's $5 gone.
I have no interest in needing to be reimbursed. I did this as a service to my community. Can we go ahead and vote? We have a motion and a second.
So, full discussion, at least on that, so. Pilot rate, 55 cents, that would be effective.
I'm sorry, effective August 1st.
Thank you.
Okay, would you say aye?
Right.
The next item on the agenda is a 2022 budget revision. And if you don't mind, Kristen, would you mind explaining the reason why we need to do a revision at this point in time? It's always good to have a good reason to do a budget revision, and we do.
Well, because I love revising budgets. It's my life. We actually received 4 additional grants and contracts. Let's see. It made a difference in our revenues and our expenditures of about $882,000, which is sizable and warranted a revision. I provided a few items. We do have the drill down again, and I highlighted on there the changes that it made to the budget.
Is that in the back?
So is this grant money that we're getting, is that what you're talking about?
Yep, grants and contracts, yes.
And somebody worked on grants and applied for them
Yes,
here. And who did that? You?
Oh, no, nope, I don't do that. So Jackie, she got the Samsha one. That's for Aspen. That was 300,000.
Wow.
And
Jackie and I wrote the public. Jackie and I wrote the health disparities.
yes, that one was for 900,000, but that spans 2 fiscal years. So just a portion of it is hitting this budget.
Tara Hall.
Tara Halter got one for substance abuse.
Mhm.
It's pretty awesome. That was her first one and she got it. So
Yeah.
we're pretty excited and proud of her.
That's great.
And then there was the program support one that Melissa and Jackie did
Correct.
together. About 150,000.
They have done a fantastic job of looking for additional resources this year. But with that good news comes the need to, there were adjustments and line items just because we've received additional revenue. So
Yes.
in order to ensure that we're capturing all of that, we're putting before you a revised 2022 budget for their approval.
Yes, for your approval. Yes, please.
Those grants run past the end of the year, correct?
Yes, a few of them do the program support one and the disparities one. They both run past.
I second the motion.
So we have a motion. Second, to approve the proposed, So.
Mr. Chairman?
Yes.
Noticing that, we're increased by $882,201.
And that they've gone through and found things to budget and to use that amount of money. But I'm very concerned that, because I don't see anything in the capital project fund, and I'm thinking that might be for our future building or whatever. I see us, we're building a new building. There's no money we put towards that. Why?
So we already had 600,000 that we budgeted from the non-operating account. And that was on the original approved budget.
Is that going to be for the building?
Yes, that's for the
Okay,
building.
great. And then okay. And then, so, I don't know if it's gonna work the same way or not. You help me out if it's not, but, if I want to build a new building, I have to come up with the down payment, closing costs, et cetera. Get a big loan, get it paid, and then refi to a lower interest rate after the project is done. So, are we gonna be able to do all of that with what we have? The 600,000, is that gonna be down payments?
So the 600,000 right now is covering like the architectural fees and any of these fees that we're getting prior to being able to obtain the bank loan. But we are in talks with the bank and they're coming up with several different scenarios for us.
And are we gonna hear about that soon? Like, what that's gonna be all about?
Yeah, they're being presented to the building committee, and the building committee will bring recommendations to the full board.
Yeah, and as far as the loan and all that, that will be later after we get a set plan so that they know specifically what the amount would be.
So we'll do away with this location. That'll become the new location. We'll still have something in Highridge and Arnold as well.
So at this point in time, we're evaluating all of our buildings and the return on investment of each. But we're looking at number of individuals who are coming in for services, the cost of the overhead. So all of that will be taken into consideration as we move forward and start working with the banks.
So I figured, we're gonna do away with, 4,000 here at this building? 4,000. A lease here in Hillsborough for 4,000, so that would go towards the mortgage of the new building eventually. We own this building. Okay.
That's the
4,000 is the Highridge location.
Yeah.
Correct.
right.
Yes.
Correct.
Is that the 600,000 you're talking about?
That's coming from reserves, yes.
That's coming from reserve?
Yeah, that's the I do not know at the top.
The last time I saw it was around 6 million. That's approximate.
So we also have 6 million to work with for our project too as well. And the only thing I would recommend is that some of this would be budgeted towards this new project that we're
So
getting ready.
we actually cannot do that. These
Yeah.
grants and contracts are based specifically off of the, what are the words?
Deliverables.
Deliverables, that is the word I'm looking for. I was saying outcomes.
Okay,
But
I
deliverables
understand
give
that.
us the
Grants are
outcomes.
specific. I get
Yes,
that.
very specific. Yeah, we don't really have a choice where we put it now.
Thank you very much for that.
We are looking for opportunities to find additional supportive funding, for our capital improvements. It just, they are very kind of limited funding sources. Okay, and then, sorry. You did like.
So hearing no other discussion, so all in favor of approving the proposed 2022 budget revision, please say aye.
Aye.
And then the final request was looking at, we were approached, thank you very much, Kristen. We were approached by Eric Ammons from Mercy Hospital, and they are looking for support to be able to reestablish their cancer center in Jefferson County. They had one about 3 years ago, and they are looking to reestablish one down here. Part of going through that process is becoming a 340B entity, which allows them to provide lower cost medications for cancer treatment. And so they have approached us as the local public health authority to gain our support for that. There's a resolution within your packet for you to be able to take a look through, but basically in order to move their application forward, they need to have our board's support for that. And I think this would be a fantastic opportunity to both expand services for cancer treatment as well as be able to support our residents who may struggle with the high cost of treatment.
So moved.
Second.
So Kelly, they're wanting to use one of our buildings now.
No.
What do they need from us exactly?
So in order to become, 340B is a program which allows you, and correct me if I'm wrong on this, ladies, to be able to get medications at a lower cost.
Okay.
Basically, it's to help populations who are uninsured, underinsured, to be able to ensure they still have quality access to care. In order for the hospital to be able to get that qualification, they need to work with us as a collaborating partner. And so they're asking for our approval, pardon me, my link. And
Because people are coming through here, going to them, or vice versa. I don't get how we connected that for them.
so as the public health authority, they need our blessing basically
blessing,
as the
okay.
to become a
Okay.
340B provider.
Okay, so favor of resolution 22-08 -04-01.
Aye.
We do have closed session.
We do, I just wanted to let the board know and public know that we do have a hearing coming up in our case that we're the defendant in Jefferson County next week. I did ask counsel whether they'd be willing to dismiss the case, considering that all of the issues in it have been resolved for quite some time. The case has had motions to dismiss pending since February. They are not willing to dismiss the case, so I just wanted to let the board and the public know that.
Can I ask you a question?
You can try, and I have to answer it.
Okay, okay. Well, if we're back to wearing masks again here, and there's treatment for COVID, there's vaccine for COVID, doesn't kill children.
None of those are issues in that case.
Why would we ever be recommending any masks to kids in school anymore, or anything like
Ms.
that?
Davis, we have, you don't know that you understood what I said. The issues that have been raised in that case were about the schools being closed. Okay, we haven't, virtually never participated in closing down schools. But to the extent that those schools had masking requirements, they have since resolved those issues. We don't have any rule over whether or not those boards of education require masking. Those issues that are in that case have long been dead. It's under doctrine what is called mootness, which means that there is no longer a live controversy. So we asked the court to dismiss the case back in February, but because the attorney who represents the plaintiff is a member of the state legislature, she asked for a stay on everything until next week. So we're going to go to court over whether or not the case still has a live controversy. I reached out to her to say, would you voluntarily dismiss? You dismissed your case against the schools. There is no current controversy pending that still is alive from the case against the health department. We don't want to go through having the expense of having to appear and to fight this any longer. As you pointed out multiple times, Ms. Davis, litigation is expensive. So I asked them to voluntarily dismiss, and they will not do so.
I think, and I'm not the attorney, but I'm seeing these masks trying to come back again. And I think they want to be sure they're protecting the kids in the school and their parents not have the quarantine.
They don't.
Games stopped, dances
That's
stopped.
not what's at issue in the case, Ms. Davis. I'm happy to explain to you what's been raised in the case. It's also available for public viewing. The petition is available on CaseNet. But there are no current live controversies from that case. So we're going to ask that the court dismiss it. And I was hoping
Was it or was it not over masking and quarantines at school?
what the schools were doing, correct. And they had separate cases.
And about us getting in on that and recommending to them that they wear masks and be quarantined.
We were in cooperation with the nursing staff in the districts who were doing the testing and making sure that their kids were safe.
So as long as we're not doing that anymore, but there's no guarantee that we're not gonna,
But that's
our
not how, that's
leadership's
not how
not gonna do
litigation
that
works.
again
Sam.
until a judge rules on it.
That's not how litigation works, Sam.
But anyway, that's my opinion.
I understand, and I'm happy to try to clarify the actual facts if you want some clarification on it.
We have nothing else?
How about the other case?
That's going to be heard in Kansas City on appeal. We have not taken the lead in any of that, which is why the expenses in that case are very low. You had a very clear mandate that you wanted to make sure that our fiscal involvement in that case stays low, and we have done a very good job of keeping the expenses in that case very low. And we have let St. Louis County and their counsel take the lead on drafting all of the pleadings, and they're going to take the lead on the oral argument as well.
Why not drop out of that and let them just do it, because it's gonna cover everybody.
We have an
even if
interest
we're not in the case.
We have an interest in it, and the board approved us being involved up to a certain dollar amount.
But aren't you seeing now that they're pretty much able to take care of it themselves, as you just said?
They're
Why can't we
taking the
just
lead on
withdraw?
it, but that doesn't mean that we're not having an interest at stake, and we wanted to participate as an interested and affected party.
So in other words, keep spending our money that we don't have to.
Discuss that with her, that's fine, that's not on the agenda.
Were we,
I don't have anything further to advise the board about this closed session.
okay, if there was a request to review documentation, that would be,
That would be in closed session.
so if we were to do that, would that be underneath,
The attorney-client privilege communication.
which is 6100211?
One.
I move that we close this meeting.
Are we saying we have an issue for close or not?
Ms. Davis had an issue that she wanted to discuss that we proper for closed.
No, I don't, no, not for close. I'm done. I said to close this entire meeting. Move to adjourn. There we go.
So are you no
Move to
longer,
adjourn.
Ms. Davis, are you no
These are my
longer
letters.
requesting to view the documents that
Oh, the
you've
documents
requested?
you're gonna show me after the meeting's over, is what you told
As
me.
I've told you several times today, we're going to view those are available during a closed session so that
Okay.
all members of the board have equal
Okay,
access
that's
to
fine.
view.
So, motion to close this session of the meeting.
Second,
Or is it a motion to go into closed session?
It's a motion to
Yeah.
go into closed
Okay.
session.
And a motion to
That's
go
the
into
verbiage.
closed session.
okay, the roll call, please.
Mr. Deal,
Yes.
Dr. Henry,
Yes.
Mr. Prater,
Yes.
Mr. Pig,